video looks at juxtaglomerular apparatus function in the kidney when tubular NaCl is low, in particular activating the renin-angiotensin system. To orient you, the JGA is here, where blood comes into the glomerulus and where part of the distal convoluted tubule passes. This cross-section of the JGA and glomerulus shows the afferent arteriole blood coming in through the glomerular capillaries and out through the efferent arteriole. This is the distal convoluted tubule with the macula densa in here. We're going to be concerned about macula densa cells, some of the renin secreting cells that are along the edge of the afferent arteriole, and some of the events in the smooth muscle cells around the afferent and efferent arteriole. The model I'll use for the renin-angiotensin system with the afferent arteriole with rings of muscle around it, going in glomerular capillaries, coming out through the efferent arteriole, also with rings of muscle around it. The macula densa cells here around the distal convoluted tubule as it passes through the juxtaglomerular apparatus, and then renin-secreting cells that can secrete renin across the epithelial layer of the afferent arteriole into the blood supply. When the concentration of salt in the distal convoluted tubule is low, blood pressure is also usually low. Let's zoom in on this macula densa cell and see that NKCC transporter is moving in less sodium, potassium, and chloride. The cell shrinks. Under those conditions, an enzyme, COX-2, is activated. COX-2 converts a precursor into prostaglandin E2, a paracrine signaling chemical. That binds to receptors in the renin-secreting cells and causes secretion of renin into the afferent arteriole. In the afferent arteriole, angiotensinogen, which is a protein produced in the liver into the blood, is converted by renin into angiotensin 1. It cleaves off a set of the amino acids, making a shorter molecule, which is further converted by an enzyme to angiotensin 2. Angiotensin 2 is the active hormone that is going to affect changes in the glomerulus and in the whole body. Angiotensin 2 has multiple effects in the body. In the glomerulus, there are two that we're going to care about. It affects contraction of smooth muscle around the afferent and efferent arterioles. In both cases, it causes constriction, but more in the efferent. So smooth muscle cells contract here. That means less blood is entering the glomerular capillaries. By itself, that would reduce the glomerular filtration rate, the production of primary filtrate, which will become urine. But there's a second effect. The angiotensin 2 has an even greater effect on the smooth muscles around the efferent arteriole where blood is leaving. So it narrows those arterioles even more than the afferent arteriole. So you get a modest decrease in size of the afferent arteriole, but a bigger decrease in size and diameter of the efferent arteriole. Between them, that means less blood is coming in, but it's at higher pressure because the blood can't leave. So higher pressure, but less volume. The net effect is to maintain the same or higher glomerular filtration rate. So we're reducing movement of blood through the kidney, which maintains higher blood pressure other places. Remember, low sodium and chloride in the distal convoluted tubule often means low blood pressure and a need to retain water and salt. Angiotensin 2 has wider effects to increase blood pressure. When sodium and chloride are low, often that means blood pressure is also low. So angiotensin 2 acts on arteries and veins throughout the bodies to constrict them. Smooth muscle contracts. That's an increase in vasoconstriction, which increases blood pressure. Second, if blood pressure is low, one way to increase blood pressure is to increase thirst. So angiotensin 2 acts on centers in the brain to increase thirst, and when sodium and chloride are low, also increases salt hunger. Put all those things together, and angiotensin 2 maintains the function of the kidneys, allowing continued filtration, while at the same time increasing blood pressure through vasoconstriction, bringing in more water, and increasing salt to match.